Hello, everyone. Welcome back to English Listening Moment. I'm so excited to be here with you today.
And I'm thrilled to join you all. We have something really special prepared for today's episode.
That's right. Today, we're going to explore a topic that I hope none of you ever have to experience, but it's super important to know about.
Absolutely. We're talking about the emergency room, or as many people call it, the ER.
Before we dive in, let me introduce myself properly. My name is Emma, and I've been teaching English for over 8 years now.
And I'm George. I work as a translator at an international hospital, so I deal with medical English every single day.
George has some amazing real-life stories to share with us today. But first, if you're enjoying our content and finding it helpful for your English learning journey, please don't forget to subscribe to our YouTube channel, English Listening Moment.
Yes, hit that subscribe button and turn on notifications so you never miss an episode. We work really hard to bring you engaging, useful content every week.
All right, let's get started. George, can you tell us what exactly an emergency room is?
Of course, an emergency room, or ER, is a special department in a hospital. It's designed to treat patients who need immediate medical attention. We're talking about serious injuries, sudden illnesses, or life-threatening conditions.
So it's not the place you go for a regular checkup or a minor cold, right?
Exactly. The ER is for emergencies only. Things like heart attacks, broken bones, severe bleeding, difficulty breathing, or sudden severe pain. These are all reasons to visit the emergency room.
I remember the first time I had to go to an ER. I was traveling abroad and suddenly developed terrible stomach pain. I was so scared, and I didn't know the medical vocabulary in English at that time.
That must have been really frightening. Language barriers in medical situations can be extremely stressful. That's actually why I became a medical translator.
Let's talk about what happens when you first arrive at an emergency room. What's the process?
Great question. When you first walk into an ER, you'll see something called triage. This is where a nurse quickly evaluates how serious your condition is.
Triage. That's an important word. Can you spell that for our listeners?
Sure. It's Triage, triage. The triage nurse will ask you questions about your symptoms, take your vital signs like blood pressure and temperature, and then decide how urgently you need to be seen.
So not everyone is seen in the order they arrive.
Exactly right. The ER uses a priority system. Someone having a heart attack will be seen before someone with a sprained ankle, even if the person with the sprained ankle arrived first.
That makes perfect sense. What kind of questions might the triage nurse ask?
They'll ask things like, what brings you here today? When did your symptoms start? Are you experiencing any pain? On a scale of 1 to 10, how bad is the pain? Do you have any allergies to medications? Are you taking any medications currently?
Those are really important questions. Our listeners should practice answering these in English, especially if they live in English-speaking countries or travel frequently.
Absolutely. Let me give you some useful phrases. You might say, I'm experiencing severe chest pain. I fell and I think I broke my arm. I'm having difficulty breathing. I've been vomiting for the past 6 hours. I have a high fever that won't go down.
These are such practical sentences. Let's talk about the medical staff you might encounter in an ER. Obviously, there are doctors and nurses, but who else?
In a busy ER, you'll meet many healthcare professionals. There are emergency physicians, who are doctors specializing in emergency medicine. Then you have ER nurses, who are specially trained for emergency situations.
What about other staff members?
You might see physician assistants who can examine patients and order tests. There are also radiology technicians who perform X-rays and CT scans. Phlebotomists draw blood for testing, and medical social workers help patients with resources and support after treatment.
Wow, that's a whole team working together. What kind of equipment and procedures might someone encounter in an ER?
Let me walk you through some common ones. First, you'll probably be hooked up to a monitor. This machine tracks your heart rate, blood pressure, and oxygen levels continuously.
I remember seeing those monitors with the beeping sounds and the lines going across the screen.
Exactly. Those beeps and lines are showing your heartbeat. If you need it, you might get an IV, which stands for intravenous line. This is a small tube inserted into a vein in your arm or hand.
What's the purpose of an IV?
An IV allows doctors to give you fluids, medications, or blood products directly into your bloodstream. It works much faster than taking medicine by mouth.
That's fascinating. What about diagnostic tests?
Common tests include blood work, where they analyze your blood to check for infections, organ function, and other issues. X-rays help doctors see broken bones or problems in your chest. CT scans provide detailed images of your organs and internal structures. And ultrasounds use sound waves to look at soft tissues and organs.
I've heard a lot of medical terminology in TV shows, words like stat and code blue. Are those real?
Oh yes, medical dramas on TV actually use a lot of authentic medical terminology. Stat is Latin for immediately. When a doctor says, "I need those test results stat," they mean right now, it's urgent.
And code blue?
A code blue is announced over the hospital intercom when a patient is in cardiac arrest, meaning their heart has stopped beating. A special team rushes to that location to perform CPR and use a defibrillator if needed.
CPR is something everyone should learn, whether they speak English or not. Can you explain what it is?
CPR stands for cardiopulmonary resuscitation. Cardio refers to the heart, pulmonary refers to the lungs, and resuscitation means bringing someone back to life. It's a life-saving technique that combines chest compressions and rescue breathing.
I took a CPR class once. It's actually not as scary as it seems in movies. The instructor taught us to push hard and fast on the chest, right in the center.
Yes, the rhythm is actually the same as the song Stayin' Alive by the Bee Gees, around 100 compressions per minute.
That's a great way to remember it. Now, let's talk about some important medical vocabulary related to the emergency room. What are vital signs?
Vital signs are basic measurements that show how your body is functioning. They include your heart rate, how many times your heart beats per minute, blood pressure, the force of blood against your artery walls, respiratory rate, how many breaths you take per minute, temperature, whether you have a fever or hypothermia, and oxygen saturation, how much oxygen is in your blood.
When the nurse says your BP is 120/80, what does that mean?
BP is short for blood pressure. Blood pressure is measured with two numbers. The first number, systolic pressure, measures the pressure when your heart beats. The second number, diastolic pressure, measures the pressure when your heart rests between beats. 120/80 is considered normal and healthy.
Let me share a quick personal story. Last year, my elderly neighbor had a fall and hit her head. I called emergency services, and when the paramedics arrived, they kept asking her questions that seemed strange to me.
Like what?
They asked her name, what day it was, who the current president was. I thought, why are they asking these questions when she's bleeding?
They were checking her level of consciousness and mental status. After a head injury, it's crucial to make sure the person is alert and oriented. We call this being oriented times 3, oriented to person, place, and time.
That makes so much sense now. What about pain management in the ER? How do doctors assess and treat pain?
Pain assessment is really important. Doctors will ask you to rate your pain on a scale from 0 to 10. 0 means no pain at all, and 10 is the worst pain you can imagine. They'll also ask you to describe the pain. Is it sharp, dull, throbbing, burning, shooting, or aching?
And the location of the pain matters too, right?
Absolutely. You need to be able to point to where it hurts and describe if the pain moves or radiates to other areas. For example, heart attack pain often radiates down the left arm or up into the jaw.
That's really important information. What kind of pain medications might be given in the ER?
It depends on the severity. For mild to moderate pain, you might receive over-the-counter pain relievers like acetaminophen or ibuprofen. For more severe pain, doctors might prescribe stronger medications. Everything is carefully monitored to ensure patient safety.
Let's talk about discharge from the ER. What happens when a patient is ready to go home?
When you're discharged, you'll receive discharge instructions. These are written directions explaining how to care for yourself at home. They include information about medications, when to follow up with your regular doctor, warning signs to watch for, and when to return to the ER.
I always tell people to read those instructions carefully and ask questions if anything is unclear.
Exactly. Don't be embarrassed to ask questions. It's better to understand everything clearly than to make a mistake with your care at home.
What about the phrase, "you're not out of the woods yet"? I've heard that in medical contexts.
Great question. This idiom means the patient is still in danger or their condition is still serious, even if it has improved somewhat. For example, we've stabilized your condition, but you're not out of the woods yet.
George, based on your experience, what English phrases should someone absolutely know before going to an ER?
Here are some essential ones. I need help immediately. I'm allergic to penicillin. This is a medical emergency. I can't breathe. I'm experiencing chest pain. I feel dizzy and nauseous. I think I'm having an allergic reaction. Where does it hurt the most?
Those are incredibly useful. Before we wrap up, do you have any advice for our listeners about ER visits?
Yes. First, know when to go. Don't hesitate if you think it's serious. Second, bring identification and insurance information if possible. Third, bring a list of your current medications. Fourth, if you can, bring someone with you for support. And fifth, be patient. ERs can be very busy, but every patient will be cared for.
Wonderful advice. Well, everyone, that brings us to the end of today's episode on emergency room vocabulary and procedures.
We hope you found this helpful and educational. Remember, we really appreciate your support, so please subscribe to English Listening Moment on YouTube.
Yes, subscribe, like, and share our videos with anyone who's learning English. Your support helps us create more content for you.
Until next time, keep practicing your English and stay safe and healthy.
Goodbye, everyone.
Bye.